we are going to go over Pharmacy Practice Final Exam Study Guide. The questions will not be in this order because they're listed randomly for you. It is a 50-question exam. You will not get all of them, but you will get most of them. Okay. Remember when we talked about isotonic, hypertonic, and hypotonic? And we're talking about solutions and cells and what it does to the cell. So if somebody comes in and they're dehydrated or in shock or something, you need to send a hypotonic or a hypertonic or an isotonic. You need to know if it puts water in the cell, out of the cell, or if it's equal and it balances itself. So the isotonic is equal. ISO is equal. Just like in an isosceles triangle, the sides are equal, ISO. Hypertonic is where it's really concentrated outside. So the solution you're putting in is really, really concentrated versus the cell. So it's going to pull water out of the cell. Keyword is out. Hypertonic is out of the cell to try to dilute the outside. Hypotonic solution is going to try to dilute what's inside the cell. So water is going to go into the cell. Hypo, the big O, is going to make the cell fat and pop. Hypo. Anybody have questions on that one? Okay. Everybody knows what IV stands for. Intravenous. On your prescriptions, there's a DAW box. It stands for dispense as written. Facts and Comparison book is a reference book. It organizes the medications by organ system and the mechanism of action. So that's actually why it's a great hand tool for pharmacists, because we're looking at the mechanism of action. That is how the drug is going to work in your body. Mechanism of action is where it works. Sometimes it's activated someplace else.
What was it called?
The Facts and Comparisons. Drug Facts and Comparisons, but it's Facts and Comparisons. It used to be this great big huge brown book that every month they'd send you an update, and you would have to pull it apart and put really thin, real thin pages in, and they would tear, and it was a big mess. Now it's just online. But every single retail pharmacy and hospital is mandated to have access to that prescription. Okay, the one that always tricks people up. And a SIG. QD stands for once daily, every day. D/C or DC is discontinue therapy. 0.9% sodium chloride is also known as normal saline because it's isotonic and it's equal to blood pH. So that's always kind of the standard go-to. If you got to grab anything, you're going to grab your sodium chloride. It's like your tears. The Board of Pharmacy is who gives you your license. Your pharmacy license comes from the Board of Pharmacy. Back to SIG abbreviations again. AD stands for right ear. ML is milliliters. AAA is apply to affected area. Okay, we're talking about patient rights, the 5 rights. We want the right patient, the right drug, the right dose, the right route, and the right time. Patient, drug, dose, route, time. And we practice this in lab when we're using our graduated cylinder and we're measuring water. If you have to measure from the meniscus, the lower part in the middle, not on the edges. An EMAR, or MAR, stands for an electronic medication administration record that is used to document when a patient is given their medicines. It's used a lot in hospitals and nursing homes. Electronic medication administration record. Okay, back to SIG codes. GTT, drops. Okay, so the abbreviation that we use on our prescription pads and everything, it stands for to receive is your RX. To receive, RX. Microorganisms that are highly resistant or immune to medications are called superbugs. It's not a fake answer. Superbugs. Microorganisms immune or highly resistant to medications are called superbugs. Okay, back to acronyms. MDI stands for meter dose inhaler. M, D as in dog I, is a meter dose inhaler. In the first 2 weeks, we talked about state board associations and federal board associations. They exist in most part to support pharmacists and pharmacy technicians. State board associations exist to support and represent pharmacists and pharmacy technicians. Okay. The 1990 Act that instigated counseling of patients by the pharmacist, and I did part of this research as a pharmacy student, was for OBRA. It stands for Omnibus Budget Reduction Act. Has nothing to do with pharmacy, but that's the act that mandates pharmacists have to counsel patients on new prescriptions. Omnibus Budget Reduction Act, OBRA. Okay. The act that regulates the quality, quantity, strength, purity of drugs in the United States. And the reason I remember this is because of purity of drugs because it's the 1906 Pure Food and Drug Act. Pure Food and Drug Act. Because remember, way back then, we were part of grocery stores. So kind of the key term is when it's giving you the list and quantity and things, it also talks the purity. That's my flag. Purity of drug is the Pure Food and Drug Act. That's how I link them, or always remembered them for testing. Okay, when a pharmacy technician is compounding, the pharmacist is required to possibly check your two things, calculations and measurements. When pharmacy technicians are compounding, the pharmacist is to check your calculations and measurements. Okay, the organization that inspects hospitals, this including the pharmacy portion, is the Joint Commission High Standard of Care. Joint Commission High Standard of Care, but in slang everybody talks about JCO is coming. They inspect hospital for patient safety and regulation policy safety. Okay, back to a fun one. AU. That abbreviation stands for both ears. OU is eyes. AU is ears. Kind of pounding the ears into you because everybody, that's a missed sig. A lot of accidents get made where it's put in your eye. It's not. A is your ear, auditory. Okay. The federal law of April 2003 set the standard on health information. April of 2003, it's the HIPAA, Health Information Portability and Accountability Act. But we refer to it as HIPAA, Health Information and Portability Accountability Act. Oh, couldn't read my writing. Took me a second. Okay. We're defining this word. Blank establishes a procedure for organizing daily workflow. Procedure for organizing daily work is workflow. So you'll hear everybody talk about the workflow on the counter. The counter is the same thing as the bench. Workflow on the bench is clogged. We need to speed it up. Workflow. All right, the FDA Orange Book. FDA Orange Book is the book that tells you what generic drug you can substitute. Generic drug substitution, use the reference FDA Orange Book. When you're drawing fluid from a vial and you want to prevent coring of the rubber stopper, the needle's bevel should face Good job, everybody. That was funny, everybody. That is super duper important. Nobody wants a core to go in their vein. And this is really kind of a vague, random one, so I definitely wrote this one down. Classes of common drugs usually have the same blank. Classes of common drugs usually have the same suffixes. They end in the same ending. Like beta blockers, armatoprolol, LOLL, atenolol, propranolol. If they sound alike, they are alike. Okay, we're getting close. Okay. When working with hazardous drugs, cloth lab coats, surgical scrubs, and gowns increase exposure on the skin, and they hold the drug against the skin. So the keywords are drugs and increase. So you always want something plastic to wick it away from you. Cloth of any kind wicks it toward your skin and increases your drug exposure. When writing numbers, always use leading zeros to prevent dosage errors. When writing numbers, always use leading zeros to prevent dosage errors. So don't put decimal 75, print 0 decimal 75. Okay, back to SIGs. AC means before meals, but this is something the Joint Commission does not like because it's misinferred or it is read incorrectly. But AC is still very commonly used for before meals. They'll, like a lot of times they'll say, take this medication 4 times a day, before meals and at bedtime. AC is before meals, and the Joint Commission doesn't like it. That's a true false question. I don't mean to get caught up on the Joint Commission doesn't like it part, because it's true. Who believed that you needed to balance the 4 environmental elements plus the 4 humors of the body? Who believed you should balance the 4 elemental elements plus 4 humors of the body? Hippocrates. And that's an HH. Hippocrates believed in the humors. Yep. Just Hippocrates believes in the 4 environmental elements must be balanced with the 4 humors of the body. Humors of the body, Hippocrates. Humors, Hippocrates. Humors, Hippocrates. Did you get it, Abby? Okay. FDA's Modernization Act. FDA's Modernization Act differentiated manufacturing from compounding. FDA Modernization Act differentiated manufacturing from the skill of compounding. Good. The act passed by Congress in 1938 required drugs to be proven safe and effective. It was the Federal Food and Drug and Cosmetic Act, FFDCA. Food, Drug, Cosmetic Act, 1938, required drugs to be proven safe FFDCA, Federal Food, Drug, Cosmetic Act. Okay. This is any health information used to ID a patient. Any health information used to ID a patient is protected health information. So it can be flipped around so that protected health information is any health information used to ID a patient. As a true-false question, that any might throw you off. Don't let it, it's true. Any information used to ID a patient is protected health information. Okay, back to sync codes. TID is 3 times a day. TID, 3 times a day. The symbol of pharmacy. What is the symbol of pharmacy? The bowl of Hygeia. Hygeia is Hygeia. I think the other choices were stuff like a snake, a cross, things kind of like the medical symbol, things like that. People do use that for locations, like they'll have that on the outside of the farm, but the symbol for pharmacy is the bowl of Hygeia. The study of blank is drugs and their interactions. Study of blank is drugs and their interactions. It's pharmacology. It's the simple one. Pharmacology. Not pharmacokinetics, not pharmacodynamics, just pharmacology. Keep it simple. Okay. Okay, it was the Kiefer-Harris Act that made manufacturers prove to the FDA that a drug was effective for a particular indication and that it worked. So they couldn't say they could cure anything anymore. We'll cure all, couldn't be used anymore. And that was the Kiefer-Harris Act. Kiefer-Harris Act made the manufacturer prove to the FDA that the drug was effective for a particular indication and it helped that indication. In a hospital order that should be filled and delivered within 15 minutes, stat. Hospital order that needs to be filled within 15 minutes is a stat order. In hospital orders, when pharmacists or anybody have to write notes, they're called SOAP notes, SOAP. SOAP stands for, SOAP stands for subjective, objective, assessment, and plan. SOAP, you evaluate subjective patient characteristics, objective patient characteristics like labs and facts you've been given, assessment, what you see, and P is your plan, what you plan to do for this patient. And that's going to be the pharmacy practice final review.